Neuropsychiatric symptoms, or NPS, are the mood and emotional symptoms of dementias and other brain diseases that are often overlooked and undertreated. They can have an enormous negative impact on the patient, their loved ones, and their caregivers. Different diseases or brain injuries produce different neuropsychiatric symptoms, depending on what part of the brain is impacted. In Alzheimer's disease, a slow, fatal disease of the brain, plaques and tangles accumulate in different parts of the brain, killing cells and leading to a wide range of symptoms. Neuropsychiatric symptoms are in addition to the memory loss and cognitive changes that most people think of when they think of Alzheimer's. Because the disease is progressive, it will inevitably cause more and worse symptoms over time. Eventually, all patients will experience one or more neuropsychiatric symptoms. Neuropsychiatric symptoms are often the earliest sign of Alzheimer's disease, occurring even before a diagnosis. When combined with the early memory loss and cognitive changes, people with Alzheimer's can find that they have trouble managing finances, miss appointments, lose interest in things they previously enjoyed, jeopardize relationships with loved ones and family members, and even get themselves into dangerous situations. Without a diagnosis, these symptoms can be especially hard to understand and manage. Even after a diagnosis, the symptoms are often stigmatized and misunderstood. Depression is often the earliest observable symptom in Alzheimer's, impacting up to 40% of people with the disease. As the disease progresses, cognitive impairment can make it difficult to understand and express feelings of depression. It's important for loved ones to check in and watch for social isolation or withdrawal, changes in eating or sleep habits, agitation, fatigue, irritability, feelings of worthlessness or hopelessness, and thoughts of suicide, which can all be signs of depression. Agitation can cause pacing, sleeplessness, or even aggression, where the person lashes out verbally or physically. Apathy, or the lack of emotion or interest, usually manifests as a lack of motivation to participate in social activities and emotional indifference. Psychosis in Alzheimer's involves delusions and hallucinations. Delusions are false beliefs, like thinking that someone is stealing or hiding one's things, or that one's spouse is being unfaithful. Hallucinations are auditory or visual and can make a person believe that they are having a conversation with someone who isn't there, that bugs are crawling on their skin, or that some other impossible event is happening. Delusions and hallucinations can be terrifying for the person experiencing them and eventually cause them to distrust their caregivers and loved ones. These and other neuropsychiatric symptoms are scary, dangerous, and overwhelming for the patient and their loved ones. So difficult, in fact, that 46% of caregivers report that they placed their loved one in an institution when their behavior became too difficult to handle. But just when loved ones are deciding that they need help, care centers are known to turn Alzheimer's patients away because they are perceived to be difficult, combative, moody, and too much for them to handle. As the final straw, neuropsychiatric symptoms can also increase complications and speed up death. But they can be treated. It may be possible to treat the symptom itself, like depression, or to treat the cause, like malnutrition, infection, or side effects from medications. Behavioral interventions such as establishing routines, encouraging exercise, using light and music therapy, validating and reassuring, and making changes to environments can also help manage symptoms. For those that can't be managed with behavioral interventions alone, it can be helpful to turn to medications. It's critical that we start talking about these symptoms with our loved ones, at medical visits, and with advocates. We need to shake the stigma and recognize neuropsychiatric symptoms in Alzheimer's disease as a medical condition that can be treated to lessen the burden of an already devastating disease.